session that we've had in mind now for many months, if not longer, years, to try to reflect on kind of where we are and where we are going in terms of the challenges of integrated development that have a focus on population health and environment. And what we have done is assemble a panel of folks who are in many ways old hands on these issues, but sometimes in new positions, new perspectives working on them. In other cases, having written some pieces and kind of staking out some arguments for where we could and should go. And we thought we'd have a chat, so to speak. Not a bunch of formal presentations, but a conversation. We do this, as we have done many of the meetings on these topics, with the support and partnership of USAID's Office of Population and Reproductive Health. It's terrific to have Heather Diagnos from that office join us on the panel together. It's part of our HELPS project, a new 5-year program that's called Health, Environment, Livelihoods, Population and Security. And as we get along this discussion and bring former colleague Gib Clarke into the mix, you'll understand some of the origins of even that project name. It really is, I think, an opportunity. Well, it's always a good idea to reflect on where you are, where you're going, where you'd like to go. But I do think, as it'll come out through the discussion here, it's a particularly opportune time to do that in this realm, in part because of the rise of additional issues that are connected, such as the climate change one, which we'll bring into today's discussion. But also because we are having results and evidence come to fore, and we'll talk about some of those that are showing us what the impacts of some of these integrated programs are. So we hope to bring all these things into a conversation that we'll have initially here on stage and then bring all of you into it as well. So I will very quickly introduce our guests, and then we'll get started on the conversation. So on my left, Gib Clarke. Gib is a former colleague until just recently was here at the center working on our program, working explicitly on these issues and coordinating our global health initiative.
Jeff, can you speak up?
Is it not loud enough? Okay, well, I'll ask him. Maybe the guys in the booth can turn the volume on my microphone up a little bit. Thanks, Mike. Gib is now the Director of Development and Planning at the Interfaith Community Health Center in Bellingham, Washington. So he's gone to the other coast and working on health issues in the domestic context. Heather Diagnos, as I said, is with the USAID Office of Population and Reproductive Health, where she manages the portfolio, the PHE portfolio, for the office and for the agency, really. And we'll, in fact, ask her to start off and tell us where we are, given her perspective on the wide range from a geographic as well as topical approaches to these. Sono Aibe at Pathfinder International, was formerly at the Packard Foundation, somebody who is coming to these issues from the population and family planning side and is part of the process of working with other organizations to set up some new innovative PHE programs. So we're very interested to hear Pathfinders and their efforts. And then last but not least, Roger Mark de Souza from Population Action International, where he's Vice President for Research and head of the climate program there. Roger Mark is someone who has been involved in this community for a long time and was running the PHE program at Population Reference Bureau, coming most recently from Sierra Club, and so has been both on the POP and the environment side in terms of his affiliations. So with that introduction, Heather, as promised, could I ask you to kick us off with a discussion of kind of where you see the integrated development approaches on population environment? Where are we now, so to speak?
Sure. So let me first ask, can everyone hear me?
Much better than I, yes.
Okay.
Oh.
I'm going to try to not talk to my lapel here. Although I'm really tempted to do so because it's like a mini microphone. Well, hello, everyone, and I'm really pleased to be here, and it's really a pleasure to share some of my experiences. I've been working in the PHE field for about 6 years and have been working on the implementation of them as funded through USAID in Africa and Asia. Previous to my time at USAID, there were some projects in Latin America, but sadly, those have sort of phased out. I think where I'd like to start off is a bit of a history moving into where we are now, especially for those in the audience that are not familiar with PHE. And I'm sure there are some, because we tend to be a little bit of a close-knit group. And we talk in acronyms, and so I'd like to avoid the acronym soup here. For those who are new a little bit to this field, PHE is Population Health Environment. It's projects that integrate population, family planning, with other health interventions and conservation or other environmental and natural resource management interventions. And these projects grew out of the integrated conservation and development programs, which were implemented in the 80s or into the early 90s, which were really looking at integrated development and with a focus on bringing development to conservation areas. And one of the critiques of that approach was that it was broad. It was a little bit of everything but the kitchen sink. And so the population health environment field grew out of that in an interest to try to narrow down what you're integrating, which is really let's narrow it to health with a focus on family planning and conservation. And so actually the projects were called in the very early days POP environment programs. And some of us that were working on it were POP environment fellows. And this was a really in response to kind of the everything but the kitchen sink to more of a, it's just population and environment. And those projects focused on delivering family planning services to communities that really wanted and needed them, that were in and around areas of high biodiversity, conservation priority areas. They were relatively small scale projects that were working at the very local level with communities. And they were driven by a sense of this is what communities are asking for. And one of our colleagues in that field, Bob Engelman, wrote a book called More, What Women Are Asking For and the Links Between Population and Environment, that really was a reflection on what we learned from that era. And a lot of those projects were driven by the conservation community and natural resources management community that saw a need for linking family planning into the interventions they were doing at the community level. Those programs evolved over the course of several years to recognize that communities not only wanted family planning, but they also wanted other health interventions, and that a lot of communities needed basic health services. And so the population environment field was broadened to population health and environment. And also, I would say on the environment side, broadened to include livelihoods. It wasn't just about conservation of species, conservation of protecting areas, but also looking at what is it about natural resources that people depend on and how do we protect that as well. And so there was an opening to looking at how do we help people, not just depend on natural resources, but try to diversify their incomes and the types of resources that they're trying to tap to make a livelihood. And so, again, these programs were relatively small still in scale, working along isolated communities around protected areas and other areas of high biodiversity. But also an interest in looking at what is it that we're really trying to achieve through these projects. Are we making an impact? Are we making an impact beyond just what normal conservation groups are doing or what health groups are doing? Or what is the benefit of integrating this? So looking at how do we measure the benefit of integration? And also at this time, and I think Roger Mark can speak more to this, there was a link to policy activities. So it's not just about delivering services to communities, but it's about then communicating why we're doing that to policymakers at the national level and at the international level. And then finally, there was a real effort to try to do some operations research on these projects and try to really measure those results. And I can speak later on about some of those efforts as well. So coming to now the present day, where are we growing out of that broader expansion to population health and environment? What I see is that we have still a relatively small number of projects that are scattered around sub-Saharan Africa, mostly East Africa, Madagascar, and Asia, mostly the Philippines, but have been in other parts of Southeast Asia in the past. And we're still looking at a relatively small scale of intervention. And so one of the things I see us really needing to move towards in the future is how do we show greater impact, or what we like to call in the development field scaling up. And so I think right now we're looking at projects that are trying to look at how do we have more impact. I also think what we're looking at right now is projects that are still struggling with how do we demonstrate impact, and how do we show what the benefit of this integration is, not just from the perspective of I'm a conservation group and I want to show this, or I'm a health group, but also from the greater kind of development perspective. How do we show the benefit to development as a whole in terms of integrating population health and environment? I also think that where we are now, there are several really good models for how you do this integrated development. And we've shown that they're good models, that they work, and that many organizations can actually take them up and start implementing them. And also we've learned that there are other models out there that are also really good, that are not called population health environment projects, but that are very similar and that we should also be looking at and trying to replicate and study and demonstrate the impact of. At the same time, there's really a desire now to take this approach outside of a small group of conservation groups and a few health groups who are implementing it to a much larger community. And so right now what we're really trying to do is get more champions on board who are implementing this approach and who can talk about why it's such a good approach. We're trying to get more donors interested in it. And we're also trying to get more organizations that are in the field to learn how to do it, because integration is complex, and so it's not something you can just pick up a manual and do. But you really need to have some hand-holding, some capacity building. And finally, I think we've come to the understanding that PHE and integration is not something that works everywhere. It's not something that you just can do in every place that you want to do development. But it really needs to be targeted at the right places. So for population health environment programs, I think that organizations have realized that you do this where there's some relationship between population demographic factors, so where population growth is high, where there is actually a stated need for these issues, for these for population and family planning services, for health services, and for conservation services, and for in areas where if you were to address these factors in an integrated way, you would really see benefits that go beyond just the conservation and health benefits, but general development benefits. And so I think that recognition has taken some time to get to, but there is really a recognition that it's not an everything approach for everyone everywhere. So I think I'll leave it there. I have many other thoughts, but I can.
We'll get a chance to get to them. Roger Mark, Heather alluded to your work on the policy realm, and you're also just back from Ethiopia, which is emerging as one of the kind of hotbeds of this activity. Do you have kind of other reflections on where we are now in this field?
I agree with a lot of what Heather has said, and before I talk about Ethiopia, I'll actually talk a little bit about another country, the Philippines, where when I was at the Population Reference Bureau, we were trying to develop and implement a national coalition to coordinate integrated development efforts on population health and environment. And in order to get that started, we reached out to a number of individuals and organizations that we felt would be key stakeholders in that process that could represent communities. And in talking about what an integrated approach would mean or could mean for a country like the Philippines, one organization said to me, you know, Roger Mark, PHE just makes sense. And when he said that, he said, you know, I think that PHE makes sense from three perspectives. First, in terms of dollars and cents, it's a pretty cost-effective intervention that we can do very easily that responds to community needs that will have a huge impact that's felt within a short period of time within the communities. The second is it made sense in terms of sense. It smelt good. It felt good. When you took it out to and Gib, stop laughing. This is serious stuff here, man. But when you took it out to a policy maker and you said to him or her that this really is tied to poverty alleviation, it is the way that your constituents live their lives. They see this very directly, and you're operating in your budgetary administrative silos. You need to move away from that. And in investing in this kind of approach, you will respond to your constituent needs in a short period of time and win votes that it makes sense. It sounds good. And the last point is that it made sense in the sense that it was logical. That, you know, again and again, whether I was talking to a woman who had survived a tsunami in Thailand, or talking to a model farmer in Ethiopia, or talking to a woman who's been recognized and is as an environmental midwife in the Philippines, they all said to me, this is how we live our lives. This makes sense to us, it's completely logical. And I think it's very invigorating to see that we are at a moment in time when there is an increased recognition of those various dimensions of PHE making sense, and that folks are willing to think about why this is important and what it means right now. So I think we are at a good place. I think what we need to do moving forward, and I was intrigued that Heather said, we want to talk about greater impact, and that we in the development community, and I don't know if I agree with you on this, we in the development community refer to that as scaling up. I don't know that scaling up necessarily means greater impact. And one of the challenges that I think we need to address in the field is what is an appropriate scale up for PHE. What does scaling up mean exactly for PHE? And is having greater impact necessarily the desired approach? Or how do we define that? What's the appropriate way to think about how PHE can have its best impact?
Well, certainly scaling up was one of the topics, Gib, that you tackled with your focus piece, so the Helping Hands, a Livelihoods approach to population health and environment programs, very similar to today's title of the program. Do you want to reflect on this question of scale and also your sense of kind of which communities we need to engage, also playing off from one of Heather's points in terms of the evolution from pop environment to pop health and environment, and bringing the kind of different communities and the development community into the discussion more explicitly?
Sure. Well, first I just want to say it's really great to be back here. I worked here for a long time at the Wilson Center and with a lot of you in population health and environment and integrated development work. It was really a fun paper to work on because I got to talk to a lot of leading people in this field, hear their thoughts on it, and kind of reflect back on a lot of years of work in it. I also want to say happy birthday to my wife, who I guess it's not being webcast, but is probably watching at the hotel while my babies sleep. Scaling up is one of the issues that I talk about in the paper, and I actually go to bat for saying that we shouldn't be so worried about scale. This is something I think that we need to agree to disagree about. It seems to be an ongoing, maybe not feud, but an ongoing disagreement within the community. And I personally think that there's two ways to look at scale. One is replication. Can you get it to something like a cookie cutter mold and replicate it all over the place, which I think PHE does not do well, which is a good thing for PHE. And I think that taking it to scale, as in making it much bigger in a particular place, and I actually think that is probably more doable. But again, I think there's so many other battles to be fought that I don't think it needs to be one of the biggest priorities. In terms of the who we need to be reaching out to, I see essentially there needs to be kind of three things happening at the same time. One is outreach to new organizations. A lot of this Heather was referring to. Find groups, find projects that are essentially already PHE projects, but they might call themselves integrated development. They might call themselves family planning and saving the forest. There's a million things they could be calling themselves, but it doesn't really matter. I think what matters is that they're doing the work, they're documenting what they're doing, they're getting a growing evidence base for it being a good thing to do, and exchanging information with the PHE community. The second thing I think that needs to happen is there needs to be in-reach. A lot of organizations, a lot of big organizations like WWF or CI or FHI have one or two relatively small PHE programs. And I think, and a lot of work is being done already, I think a lot more could be happening in terms of working with the higher level folks within those organizations to get them on board. You can spend a lot of time getting new people in, but if you already have an organization that has bought in with one foot, it might be a little less work to get them in with the other, or more. And the third thing is strengthen what we have. Heather referred to, or maybe it was Roger Mark referred to, We have an East Africa PhD network that a lot of people in this room are working on. There's a Philippines network. Getting the different people who are already doing this work to work together, exchange information, learn from each other. There's only so much a Westerner can teach someone who's already doing the work in the field, so they need to be their own internal resource.
Let me ask you, Gib, again, another theme of this policy brief that I should wave around here, the focus piece that hopefully you'll pick up outside. You alluded to, it doesn't matter what it's called, but at the same time you're proposing a successor label for PhD. Do you want to talk about the kind of philosophy and the thinking behind the Help Plus suggestion?
Yes. I'm not going to name any names, although some of the names are in the paper. But everyone I talked to, one of my first questions was, do you have any suggestions for the PhD field? And if not the first, always the second was, give it a new name. And there was a lot of reasons for this, but I think it comes down to two main things. One is that it's seen as a little rigid. By putting it in that sort of order and knowing where the money is coming from, that big P can be a little intimidating to either conservation organizations or politicians in developing and developed countries. And secondly, there's confusion. Well, I have a conservation and family planning program, but there's no HIV component. Is that PhD? You know, a lot of people, they think they're doing it, but they're not sure. And so in some sense it's a little confusing because each letter sort of masks a bigger reality. And this sort of brings us a little bit backwards to the history Heather was saying. But you know, within population you have family planning, you have migration, you have demography. Within health you have HIV, nutrition, maternal health. Within environment you have conservation, resource management, water, those sorts of things. But the other really important thing that I think is that PhD doesn't have L in it. And both people who've spoken already have spoken to the critical nature of livelihoods. And livelihoods is really, in my mind, you know, sort of where the magic happens with PhD. It brings everything together. PhD is about meeting community needs, and when you discuss livelihoods is almost always part of the E or the conservation piece of things, but it can be part of the family planning piece. You know, if you're, let's say, giving some funds to someone to start up a corner store that sells family planning methods or something like that. But it really is, when you talk about livelihoods and poverty alleviation, this is what makes the most sense and how people get it most directly. And it ties in so nicely to family size and conservation and so many other key elements of PhD. And then plus is just because when I was talking to people and thinking back on my own experience in this field, there's so many other things, and I couldn't stand to make another acronym out of food security, water, gender, women, security, you know, the microcredit. The list is too long, and I'm not clever enough to think of a 12-letter acronym. Leave that to our Philippine colleagues. I think they're the best at that. But anyway, so besides including the L for livelihoods, I think that title really speaks to the dynamism and flexibility of PhD, which is, to me, what's so great about PhD is that it's so much more than the sum of its parts, and really responds to community needs, and that's why it makes so much sense to people when you talk to them about it.
So Sono, could you jump off from that perspective in part with what you're working on now in Pathfinder and trying to, in some ways, respond to some of these ideas that Gib has initiated with a partnership, but also reflecting on your leadership at the Packard Foundation. I should say, really, we have the two funders, Packard Foundation and USAID, who have honestly been the leaders in making these things possible from the donor perspective. But in terms of some of that same thinking that you all did at the foundation that led to support of these kinds of integrated programs.
Sure. So first of all, I wanted to say Happy World Health Day, and thank you so much, Jeff, for inviting me to join my wonderful colleagues to talk about my favorite subject of all. And I wanted to mention World Health Day because I really feel that the PHE framework is about delivering really critical health care to very isolated communities and those that are very hard to reach, but that our conservation colleagues have often found ways to reach them. So I see this very much as an important piece of public health as well. Pathfinder, just a word about it. Our mission is to ensure that people everywhere have the right and opportunity to live healthy and healthy sexual and reproductive lives. And we really focus mainly on sexual and reproductive health care in all over the world. And one of the programs that we're currently in the planning phase for is a collaboration with the Nature Conservancy in Tanzania. And I wish I brought my handy map here, but it's basically, imagine Tanzania and you're all the way towards the west and you hit Lake Tanganyika. And there's a little peninsula that's jutting into the lake, which is the Mahale Mountains National Park. And it's already a protected area and very much an important area for primate studies. And there's also a lot of interest in the lake because of the very rich endemic fauna and hundreds of cichlids that are unique to that particular lake, and a very critical freshwater resource for the rest of the world in terms of it being the second, the largest lake in terms of volume and the second deepest lake in the world. So we were actually a latecomer in this area because the Nature Conservancy and our third partner, which is the Frankfurt Zoological Society, had already been working on some of the fisheries issues and land conservation issues. So they were saying, we're doing this conservation work and it's all going well, but as we talk to the community and look at their lives, we really need to handle some of the healthcare issues around here, because ecosystem health, I mean humans as part of it, they have to remain healthy in order to be able to manage their natural resources and be able to deal with some of the potential and already happening impact of climate change. So more droughts or unreliable rainfalls, all of that is already coming. So they needed a health partner, and I think Pathfinder, having had much experience in Tanzania delivering health care, was found to be a good partner, and so we're currently in a very exciting planning stage with them. And I could certainly talk more about it, talk about some of the challenges that we're facing early in this implementing planning phase. But again, it's so inspiring, when organizations come together and really try to solve many issues from the community perspective. And really, where we most agreed on was that it's really about empowering the community to come up with their own solutions. I mean, we're just coming in with some science, some technology, some ideas, some innovations, but we really want to help them to connect the dots and to get the right, government services connected to that isolated community, advocate on their behalf to get some of those services there. So those are some of the things that we're planning to do. And yeah, in terms of my former life, which is having been at the David and Lucille Packard Foundation, and they have been a very strong and steadfast donor to the population health and environment field. And I was really part of, some initial work in the Philippines, the one that Roger Mark was mentioning, the now famous IPOP corn project in the Philippines, which is really, quite an amazing example of how a long-term sustained, donor effort and interest and strong research could really, create this wonderful case study for the rest of the world. And I have to say, it was really because Philippines was such an ideal place, actually, to try this approach, since there's so many thousands of islands, and people really had to day-to-day struggle with some of the marine resource management issues. The coral reefs were really in trouble, and the population was growing rapidly, and family planning was very much missing in the picture. So to involve policymakers into the discussion, we wanted to work on the fisheries component alongside, and so that was kind of the logic of why the foundation decided to go down that road.
So, Heather, can you connect both the Philippines issue and also your point about operations research? You and colleagues have recently published a peer-reviewed piece that tries to capture some of these practical benefits in comparing individual sectoral approaches and an integrated approach. Can you talk a little bit about that research, both in the kind of context of the need for it and how much we do and don't have, but also some sense of, on the various indicators you were looking at, what were the findings that you captured in looking at the IPOP Corm project in the Philippines?
Sure. So as Sono mentioned, the Philippines project that was implemented by the IPOP Corm, well, it was called the IPOP Corm project, implemented by Path Foundation Philippines, was a really important first step, in terms of long-term funding for a population health environment project, but then also for dedicated funding from the Packard Foundation to really do some very rigorous research on what's the benefit of this integrated approach. And that funding was then complemented down the road, maybe about 5 years down the road, with USAID funding to finalize the analysis and actually get it published. And I am a co-author on that, which is really exciting. It came out in November. And what that research was aiming to do was to really demonstrate what is the value of an integrated approach versus a single sector approach. So the research, being operations research, had a model that was just doing family planning in one project site, a model that was just doing coastal resource management and fisheries management, and then a model doing an integrated approach, and then one that was just that nothing was taking place in, so it was a control site. And the research collected data on the biophysical characteristics of the marine and fish communities, so the coral reefs, their health was measured, the number of fish, and then on the health side did a very extensive socioeconomic data collection at the household level that looked at common indicators in terms of reproductive health, use of family planning, and then knowledge of family planning, and other things like income levels, and so just taking a look at the health, the reproductive health, and the sort of income and socioeconomic condition of the communities. And then compared those across the sites. So really to take a look at, was there some improvement in the integrated site in both areas, in both the marine and the human health side, or was there no difference whatsoever? And so the research that came out in November, which is in the Journal of Environmental Conservation, shows that there was an impact. And the impact was really interesting because it wasn't, we couldn't demonstrate impact in there was a reduction, let's say, in family size, because it was only over a 4 or 5 year period. So you're not going to see that kind of reduction in that period. Similarly, you're not going to see growth in coral reefs in a 4 or 5 year period because they grow very slowly. But you were able to see impacts. Let me just say, it wasn't just coral reefs, it was also mangroves, because those were the two habitats that were mangroves are important, nurseries for fish, and so those were also being conserved. And so really the impacts that we were able to show impact in over that short period of time were more in people's knowledge about family planning and people's use of it, which there was increase in the integrated site over the single sector sites. And then also on the environment side, that there was an impact in terms of improved mangrove health and improved fisheries health. And so actually you can see an impact in fish, because over a 5 year period, if you protect a marine area, you will see that more fish rebound in that area than in places that are not protected. So there was an impact in the integrated site in those areas. And interestingly enough, also in income levels, which was an unexpected surprise. So there was an improved sort of increase in income in communities that were surveyed in the integrated site versus just the coastal resource management site or just the family planning site. And I think some of the lessons we took away from that was, firstly, it's really hard to do operations research on these types of interventions because you might try to control for factors, but you're in communities where there's a lot taking place. So while we were in there were also other government health programs that came in and delivered health services, different types of health services, different donors were working in those areas. And so it's very different to control for those factors. And so that's why we weren't able to show impact in every indicator, but only in a few indicators. And I think one of the lessons that I took away from that experience was perhaps operations research and rigorous, is integration better than non-integration? That's not the question we need to be asking. We need to be asking, what is the impact we're showing from these different integrated interventions? So not just is it better because it's integrated versus not integrated, but can we demonstrate the impact and can we tie that back to our intervention, firstly? And secondly, what's the added value? So if I'm coming at this from the conservation perspective, what's the added value to me to integrating health and family planning? Is it that I'm reaching more men through my interventions? Am I reaching more women? So what is it that's adding value to my current mode of doing the kind of business I'm doing? And so those were some of the lessons we took away from that. But also it was nice to actually show that, yes, there was some impact in this relatively controlled study to doing an integrated approach versus not an integrated approach.
And Sono, can I ask you, again, wearing your donor's hat, that I've heard different versions of how important and essential it is to have lots of this kind of evidence as a basis for then scaling up donor support for it. And others who have said, well, the public health community, they really want to see that, and that's a tradition that they're used to. The conservation folks, it's a longer timeline. They're used to, in some ways, success is something not happening, and kind of suggests that maybe we're getting too hung up on this. Do you have a sense from where you sat on that?
I think the evidence from the few evaluations that have been done well in the PHE field have really pointed to interesting findings around male involvement and youth involvement. And I think in the reproductive health field, it's always an issue of how do we involve men in these programs. And I think conservation efforts and other livelihood efforts, certainly involve both men and women and youth. And I strongly also believe that it fosters more couples communication, which is, again, an important area that the family planning community often focuses on. So I feel that with that kind of, early or proven already evidence that, health funders, reproductive health funders should be very interested in looking more at these models as one of the many that they could try out, especially if they're in a particular location where that makes sense.
I have a question. If I look at your publication and sort of the call out says a new label, health plus da 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 da, and Heather makes the point of demonstrating the added value. Now I remember a lot of our early discussions on PE, PHE, community-based, whatever we wanted to call it, what we should name it, and a lot of the criticisms about the integrated conservation and development programs. And when I go out to folks in developing countries and talk to them about this work, they say, oh, here you go. You're just coming up with a new name, a new label. There we go again. It's what's sexy now. It's where the money is. And I think, Gib, you sort of make the point, it doesn't matter what we call it, but yet at the same time, you're suggesting a new label. And one of the points that I make is I think exactly the point that Heather makes, that we need to be demonstrating, regardless of what we call it, the value added. That we're not coming in and saying this is a new development approach, but we're saying that the PHE approach has a value added to what you are currently doing, and that now we have models for easy integration, and we can show this added value. So, seems as if you all agree. They're all nodding.
Well, I'll be the first to acknowledge Help Plus is not exactly sexy. But and I was hoping no one would catch that. No, I mean, obviously I'm making two arguments at the same time, but I think the issue I have with the PHE label, and that I think many people in this room do too, is just that it's rigid and it's confusing. But if people want to keep calling it PHE, believe me, I don't mind. But because I think in the end, you're exactly right. What's important is that we're figuring out through good data, like iPopcorn is demonstrating, and through good documentation, we're figuring out how to make it work. I do think that a new label helps get around certain problems that PHE presents, but I don't think we need to. I don't think it needs to be sold as okay, PHE. That's gone. That's a thing of the past. It's just a different label. It's just a different way to call it.
But I guess, part of what I hear from people is, oh, it's just another label again. Not so much PHE, but the fact that it's a sexy label, whatever the label is.
Well, Roger, Mark, let me come back to you, because certainly one of the motivations for taking a look at how it's framed, we'll say, rather than a label, but how we're framing these arguments is in part because it has been a relatively small conversation. At the same time, recognizing there are a lot of folks doing it and have a different set of priorities, or leading with one and are amenable to others, but are know their one and are open to it. One of the big points of conversation, points of entry now for environment is certainly climate change. And so my question to you is, how do you see, and with PAI, Population Action International, you're doing a lot of work with population and climate change. How do you see that connecting or not connecting to this integrated development, population, health, environment approach? And where do you see as the constructive ways to both frame and then operationalize those linkages?
So it's a very good question, and it's a question about which we had somewhat of a discussion yesterday at Population Action International. I see one of my colleagues shaking his head in agreement. We had an internal discussion, and I was saying to my colleagues very often that I go out and people say to me a number of things. First, they would say to me, well, Roger Mark, are you going to Africa and telling an African woman that she should not have a child because her child is contributing to CO2 emissions? And you're coming from the United States. And then the second question that I often get is, there are enough reasons that already exist for us to think about how we integrate reproductive health, family planning, service delivery into other programs. We don't need an additional reason like climate change. We have enough already. I obviously disagree. I recognize these arguments. I think they're good, valid points, but I go back to the field. And I've recently come back from Ethiopia and reflect on a discussion that I had with a young mother there. And I was talking to her about the environmental club at her primary school in this rural village, and she was standing in front of her mud hut. So you just have this picture. I'm talking to her, and behind her is her mud hut. And she says to me, Roger Mark, you have to understand that in the environmental club, we feel that as parents, we have a moral imperative to talk to our children about how they reduce their CO2 emissions. I thought, wow. And I got back to my hotel, and the same colleague who's sitting in the audience today, Mark, sent an email to me saying, did you just see the latest survey? Americans are saying Obama needs to put the economy before the environment. And I'm just thinking, well, some Ethiopians are saying we have a moral imperative. That's a very powerful message. At the same time, in that same village, I met another young woman who was 29 years old and who had 12 children. And I said to her, wow, you have 12 children. And she said, well, some of them are adopted. How many? One. So she gave birth, or at least 11 of the children that she gave birth to survived. And I said to her, well, what's different for you now? And she says, well, today I have access to family planning. I am using contraception. And if I didn't, I would have had 3 to 5 more children. But more importantly, and as part of that, I am now today recognized as a model farmer. I have received training from an integrated population health and environment program that has taught me how to produce drought-resistant crops, because I am seeing the impact of climate change in my village. I need to provide for my 12 children, and I'm also doing rainwater harvesting. And I have the knowledge. So I am using family planning, I am generating money for my family, I'm serving as a model, and I'm going and talking to other young women about decisions that they can make, that we can make, about how we can be reproductive and be productive. And she was framing that very much in the context of climate change, increasing her resilience, reducing the vulnerability, increasing the livelihood opportunities and well-being for her family, and really pull that together in a very compelling way that I thought was quite convincing.
In that context, then, I'd ask you whether, do you find it useful then to distinguish between the climate mitigation and the climate adaptation perspective as a way to address some of the critiques that you put up front, but also to reflect some of these realities that you're seeing on the ground?
Most definitely. You know, what we're seeing is that those who are most vulnerable are most adversely impacted. They're not victims. They can be positive agents of change, and that we at PAI and with other partners need to address the questions around mitigation also. We recognize that population has an important role to play in reducing CO2 emissions, that providing access to family planning services also has a role to play, but that when we look at the questions around mitigation, we need to mobilize ourselves and recognize that that is important. But with our partners in developing countries, we're focusing more on adaptation and really learning a lot from them and being inspired by them. They are leading the work. Really, we're trying to catch up with them and support them and provide science and help with advocacy and research and communications. But really, they're the leaders. We are privileged to be there with them.
And Heather, certainly the climate change dimension has been added to the portfolio that you and your office are asked to look at reproductive health issues in these first conservation and now climate contexts. Can you reflect on how that's playing out from your vantage point, and then as it connects to the programs in your portfolio?
Sure. So I think there has been increased interest within the agency around climate change. So there's a new climate change program, and there is new funding that looks at both mitigation and adaptation within the agency. And so it's one of the three major initiatives which is being launched within USAID, along with the Global Health Initiative and Feed the Future. And so our office was really interested in saying, well, this is one of the major initiatives, so let's look at how we link to it. And there was some recent, I guess it was last year, there was a paper that was released that looked at sort of the impact of population on CO2 emissions. And that was something that we wanted to take a look at and just say, how does this play into, that was on a global scale, but how does this play into what we're doing on the ground? And I think after taking a look at that, we really came to the same conclusions that Roger Mark just came to, which is that that is really an important sort of fact and some important information for us to reflect on here within the United States. But what really matters to the communities that we're working with and the countries that we're working with is really how does their family size, how does their reproductive health, and how does their communities, how are these factors really impacting their ability to adapt to climate change? And what are the impacts that they're experiencing on the ground, and how can we help them adapt to those impacts? And personally, I also feel that having smaller, healthier families is an important way of adapting. You know, you're better able to survive the shocks of climate change if you have a smaller and healthier family. And so I think that that's really where we're coming at this issue from. But in terms of what we're doing, we're really looking at, okay, we believe that, but is there some truth behind that? And so we're really interested now in looking at, well, what are some of the links between smaller and healthier families and the ability to adapt, and sort of examining that hypothesis a bit further.
Could you also maybe say a word about the collaborative cross-agency process looking at the impacts of glacial melt in the high Himalayas, given some of a specific place and context for asking these questions?
Yeah, and thank you for reminding me. I totally forgot about that. So over the past year, we were really interested in looking at what, I was working with a colleague from the Asia Bureau, Mary Melnick, really interested in looking at what is the impact of glacial melt in the Himalaya region on the communities that live near the glaciers and downstream from the glaciers. And we were interested in looking at it not just from a agricultural perspective or from a water perspective, but really a holistic perspective, really coming from it from sort of a PHE perspective, which is what are the impacts of glacial melt on the communities and the people, but also what are the impacts of the people that are living in those areas on glacial melt as well, and looking at it from sort of both perspectives. And what we found from that is that, firstly, it's really hard to look at these issues. Glaciers are huge, and the melt impacts so many people downstream. I think we sort of found out that it was between 6 to 8 million people living downstream, not 600 to 800 million people. And also that it's really a very complex linkage to look at. But what we really saw was that you really do need to look at something like glacial melt from an integrated perspective, because the people who depend on the meltwater from the Himalayan glaciers depend on it in so many different ways. It's their drinking water, it's their agricultural water, it's also flood waters that might cover their communities. I mean, there's so many different impacts. There's also governance issues around India and Nepal and China and who governs those glaciers, and these are all things you need to take into account if you're going to try to address that. But in the same token, you also want to look at those communities and say, what kind of agricultural practices do they have, and how dependent are they on rainwater and on glacial meltwater? And how are those communities living? Are they densely populated communities living along the Ganges River who are going to be really impacted all at once by having less river flow or having a flood event in that area? And how can we help improve those communities and their health and their existence basically in that area? And so what we took away from that exercise is that it is really important to look at those climate change impacts from a really holistic perspective and design strategies to address those that are also holistic as well. So the next challenge is, okay, we know that, now how do we do it? And that's what we're working on now.
Right, and I should say for both Gibbs' new focus piece as well as this Himalayas report, which in addition to the things Heather said, starts with a baseline of what we know about the climate science and the impacts, are both available on the wilsoncenter.org/ECSP website. Before we had a launch on that event as well. But Heather, that point brings up the question of scale, which is one that we had very early in the conversation, suggests a higher level, at least from the initial analysis. Roger, Mark, and Gib had a couple takes. Sono or Heather, from your perspective on this question of scale, and again, I look at the two of you as ones who have the donor perspective as well, because I think there's a perception that if we can't get more people involved and bring and extend it to other sites, then it's a question of whether the sustainability of the whole approach itself. Is that hypothesis or that statement one that you subscribe to, and if so, what are the ways that you see us getting to those larger scales and ensuring the sustainability?
Can I take this one first? Because I wanted to respond to Roger Mark, who sort of said, why should we worry about scale? And I think this is an interesting debate to have. because I just came back from a month-long trip in East Africa looking at PHE projects in Kenya, Rwanda, Uganda, and Tanzania. And one of the things I took away from that visit was that I was visiting projects that were really small in scale and wondering what they all added up to in that region. And I think one of the issues around scale, I mean, I think it's really hard to have this conversation because you're making a real impact for the people that you're serving in those areas. And these are people, I was in Bwindi National Park in Uganda, and these are people who are living around this national park who have absolutely no access to health services. So for them, if you're reaching 500 people, you're making a major impact in their lives. And you're also helping to improve their lives in a way that no other group is because you can hardly reach them. But at the same time, then you think, okay, well, Bwindi is one very small national park. And if we're looking at global environmental issues like climate change, like disappearing forests, what kind of impact are you having when you're working with 3 or 4 communities living around this park? And what kind of impact is that when you're trying to really make some kind of impact at a global scale on environmental issues? And so that was one perspective I came away from that trip with. And another on the health side, which I hear often from my colleagues within USAID, is we're interested in reaching millions of people, not thousands or tens of thousands. We really want to see an impact on a large number of people. We want to reach a lot of people. And the PHE programs are doing a great job at reaching people we don't normally reach, like Sono said, but we need to make sure we are spending our money wisely and reaching as many people as possible. And so there's a bit, I think, of a dichotomy between making it matter to people who really don't have access to any services versus trying to reach a lot more of those people.
Yeah, I would say, first of all, I want to mention that the PHE toolkit, which was developed under the Balance Project that Heather's shop is supporting, has been very useful in terms of practitioners, coming to this field and wanting to kind of find the necessary tools and manuals of how to do this project. And so I feel like, in terms of whether we can replicate these projects, more broadly, I think those tools are essential, and, congratulations for creating that wonderful toolkit. So I think that's one way of doing it. I think more, collaborations and exchanges between developing countries across, many different countries would be helpful in this particular area. I often think about, when people mention scale, I often think about policy impact. And I guess a lot of people are already thinking about, for example, Rio +20, which is, coming up, and there are a lot of discussions being had about what that's going to look like. And, the theme being sustainable development, wondering if some element of this PHE thinking, could be part of that. Certainly, it's very hard to translate what we know, what we have seen and felt in these projects to the theme of green economy, for example. But I think we should look at that and see if there's any opportunity. I'm also often thinking about, after the MDGs framework kind of comes to an end in 2015, what's going to emerge from that. And so again, looking at, how do we convey this community-based approach that really responds to communities' felt needs in a very integrated fashion and a cost-effective fashion. How do we translate that into the next phase of development goals, whatever they may be? And it could be that the next round of MDGs or, a framework could be much more crisis management oriented, given that there's so many disasters and, water shortages, conflicts, and epidemics, and perhaps, these sort of linked programs really speak to that framework.
Well, we've obviously had a chance to have a conversation up here. What I'd like to do now is open it up to questions from the floor. Have a colleague, Kaylee, will bring a microphone. So I ask that So the video captures your question, that you use the mic and identify yourself and pose your question to the panel or to individuals. Either one is just fine. Would someone like to kick that segment off in terms of the discussion? Gentleman down here. Going to get a workout today, Kaylee, with only one mic.
My name is John Williams. I'm with the Population Strategies Group. I'm interested in the discussion of scale. Scale is two things. It could be scale in terms of size, magnitude of a project. Scale also in terms of time. How long does it persist? We go out into these communities, we create great activity buy-ins by the local community. What happens 2 years later, 3 years later? Or the little area of these communities are the park, where I've done my own work has been in communities where endangered species. The communities, if the park is still there 5 years later, if the tree kangaroos are still alive, you've accomplished something. So the scale over time. So I guess my question really is to Heather is to look at the time dimension and following up on these communities.
I'm glad you asked that question, because actually one of my issues that I didn't get to talk about was sustainability, which I think kind of ties into your idea of time scale. Because I think there is a danger of pulling out too quickly from these kinds of integrated development approaches, and they do need a longer engagement with the communities in order for some of those things to stick, for delivery of family planning services or of other health services. And I think it's a really important issue, and I don't think that the community has really been able to wrap their heads around it or come to some very successful idea of how long we need to engage and what does sustainability look like. In some of the cases, I was just in Rwanda, like I said, I was visiting a coffee cooperative that had decided to integrate family planning, HIV/AIDS, and water into what they were doing with their members. And in that case, they were very empowered. The cooperative itself was very empowered to carry those activities on. They had funding from the coffee sales that they had to actually continue to provide the health services. And they had agents who had been trained, and those agents were willing to continue to go out and provide the services that they were providing in terms of distributing water purification, getting people into clinics for HIV testing, and distributing family planning commodities. And in that case, it works. So I think, again, back to what Gibb said is, it's a case-by-case basis. It depends what it is you're doing, who you're working with. But I think it's a really important point and something we all need to keep in mind. So thank you for raising it.
And I would just add to that Heather sort of hinted at in Rwanda, in the Rwandan case, there's a livelihoods component. There's income being generated, and that can feed into help sustaining the program financially. But the other thing, and I think Roger Mark hinted at this earlier, is that these programs, because they bring together family planning, which is traditionally mostly around women, and conservation, which often includes more men, and because these integrated programs seem to be so good at bringing in youth, you have a much more engaged population around a program. So there's obviously, when any kind of program leaves, there's all sorts of ways it can go wrong. But I think between the livelihoods part and the increased community participation, it's an advantage.
Roger Mark, maybe you could speak to that too, including the example of the difference of working with NGOs and working with the public sector, and some of the experience with mayors and having that sustainability come from local officials putting internal resources, local resources to the problem, and not just relying on the external sources of funding.
I think it's a very good question, John. So thank you. And I would say I agree with what Heather and Gibb have said. I think Gibb's point about livelihoods is very important. I think many of us are familiar with the condoms and cabbages work of Michai Viradai in Thailand, which is not necessarily a PHE program in and of itself, but I think many of us look to it for models, and he really has set up a system that has been sustained over time that links reproductive health, women's empowerment, HIV/AIDS testing, commercial endeavors, working with assembly plants to provide reproductive health care, setting up organic farming, setting up hotels and commercial investments. So there's a very strong commercial livelihood component of it that I think has sustained that work over time. And in the Philippines, the iPop Corn Project has in fact taken folks who are resistant to the PHE approach, particularly Catholic leaders, to Thailand to see what Michai has done with his condoms and cabbages work, and they come back convinced. So I think an element of sustainability is showing, demonstrating programs like that that have worked, that have a strong livelihood component, and that enables folks to demonstrate that ultimately you're working towards improving people's well-being. And I think that that's an important component that the research has also found. Some of the research on PHE programs have demonstrated that it does not matter what model you use for PHE integration. Others of us in the PHE community disagree and say if you're thinking about sustainability of interventions and you want to capitalize on community buy-in, it is better to have an integrated approach from the very beginning. So instead of having an environmental or conservation program that brings in a family planning or reproductive health component later on, if it is designed from its inception as integrating all of those various components, it tends to be more sustainable over time. In terms of working with the public sector and mayors and decision makers, they tend to be more motivated and willing to engage when they hear back from their communities that this is an approach that the communities want, that is very valid and is very accurate. And I think at Population Action International, this is part of the message that we try to convey and relay. At the moment, we're working on a film that is documenting the impacts of the linkages between population and climate change. We have footage from Nepal, Ethiopia, and Peru, and it really tells a number of very, very compelling stories with beautiful footage that really in 12 minutes will convey to policymakers that communities get and understand this linkage because it makes sense, and that there's a need for policymakers to take action on that. So I think also thinking about ways to scale up, to get the community message out to policymakers, to have the stories that we can tell in a real and compelling way, and to demonstrate that this is what constituents want and that there's a need for urgent policy action will help move that agenda forward.
Could I take the liberty of calling on Kathleen Mogelgard to expand on Roger Mark's part, just because I know that she's come back from Bangladesh looking at some of these same population climate change issues. And she had a question anyway. So
Great, yeah, thank you. I actually wanted to follow up on this question of what scale up can mean in the context of PHE. And I did just come back from an international community-based adaptation to climate change conference that was in Bangladesh. And the theme of the conference was scaling up beyond pilots. And it's so interesting to me because I feel like this is a conversation that's happening in parallel within the climate change adaptation community, and especially those in the climate change community that are really concerned about community-level interventions to adapt to climate change. And one of the themes that came out through this discussion on scaling up at that conference was to think about what are the ways in which we can affect the policy environment to be more enabling of community-based approaches that are integrated, and especially in thinking about climate change adaptation, where so much of the discussion right now is kind of coming from a top-down perspective. How can we create policy environments that enable a meeting of the top-down information with the perspectives of the community and what communities are feeling in terms of their own needs to be able to cope with climate change? And so I've been trying to think about is there some sort of parallel thinking around scaling up in the policy environment for PHE? What are the kinds of national or international policies that would help to create an enabling environment for community-based approaches that bring together these multiple needs that are felt by a community, and that enables the integration of the population piece. I think that's something that, in what I've seen of the community-based adaptation approaches so far, again, the population piece is one that's kind of overlooked. So I would love to hear comments from anyone on the panel. And Sono, I know that you raised the idea of scaling up through the policy environment and things that we might be able to do to better create an enabling policy environment for this kind of work.
Yeah, if I may just respond to that quickly. I think PHE often, as I try to now implement or start to look at this project with the two partners in Tanzania, I think the key is to find local counterparts, either government, NGO, or both, with whom to house the innovations that we're going to bring. These integrated ideas, the value-added indicators, all of the things that we could bring as new knowledge into Tanzania in this particular area. And so I think that partner selection is really important, and yet so difficult, because if you're working in a multi-sectoral way, you immediately have to deal with multiple ministries and multiple departments, and so that's one thing. But I think thankfully, because a lot of countries have decentralized power, budget authority to local districts, for example, so perhaps that opens up a door where we can work directly with district governments, who are already thinking in a very integrated manner and may have development plans and budgets that are, quite integrated. So that, I think, opens a window. But whether, we're happy with just that district level integration, or what does that look like when you're trying to talk about it at the national scale? That's another, I haven't come to an answer yet myself, but thinking about that.
Well, I just want to add a little bit to that. I think that's a huge question, but one of the things that Sono was just getting at is it has to do with the funding of it, and I think the funding needs to be, there needs to be a little more flexibility in the funding. If you read the paper, you'll see that I cite 2 or 3 foundation people, no one wanting to give their name, unfortunately. But a theme that kept recurring with foundation folks I talked to is that they get it, they know it's important, and even they're being encouraged from the people up top at the foundations to integrate, but there's not a lot of systematization for it, and there's not a lot of real incentive for it. You're ultimately judged on the performance of your family planning portfolio, or of your climate change portfolio, or whatever it is. So there needs to be some sort of incentivization and some sort of reason besides that, hey, it would be great if we integrated. And the second thing is that because PHE is most clearly beneficial when you're on the ground in the community, watching it happen, watching it come together, I think you put those things together, and what you get is the opportunity is to get the local government units or local foundation field offices or missions or whatever to get involved in the funding, and then hopefully that'll generate some sort of momentum which can allow the bottom to meet the top, if you will.
Jason, then we'll come over here.
Thanks. Jason Bremner from Population Reference Bureau. And I have a lot of ideas. I'll just try to share them briefly. But from my perspective of traveling around East Africa and working with these projects with champions over the last 3 years, I would say in terms of scale and sustainability that things are really promising. And they're a lot more promising than they were 10 to 15 years ago when we started thinking about pop environment projects, or when Packard was originally funding things in Madagascar and the Philippines. And why? I have maybe 5 quick things I'll say. One is just simply the number of projects themselves. Those that call themselves by a PHE label and those that are doing PHE but not under that label is really growing. And each time that I go to the field. I learn about a new project, and it's really my own inability to keep up with the developments in the field that I think hinders our thinking of, or maybe propagates this idea that it's a small little clique. There are a lot of organizations that are getting involved in this, and more every day. And I know that the Balanced Project, Linda Bruce can attest to this too, because she's doing the same type of traveling that I'm doing. The way that they're growing is also really promising. It used to be that maybe there was a call for proposal, or a particular donor that was interested in doing this, and they went looking for people who wanted to do this or were doing something similar. I think now what I'm really seeing is there are organizations that want to do this, and they're finding ways to do it through partner relationships, through diversifying funding sources, through sometimes no existing outside funding at all. And so I think that will lead to sustainability. If the organizations are committed to doing it, they'll find the resources to do it. The third I mentioned is that the funding sources are diversifying. I've seen new private foundations. I learned of Danida, the Danish funding agency, CETA, the Swiss funding agency, DFID, all looking at this or funding things that are specifically called PHE. So that's promising. Sono mentioned the toolkit. The resources that are available to these people who want to do this now are organized and available thanks to the Balanced Project and K for Health and USAID support for that. And the links that we're making between the projects, something that Gib mentioned, are increasing. And that's also thanks both to Packard Foundation and USAID, who are supporting our organization to try to link those champions. And finally, a lot of the models are now engaging the public sector service providers from the outset, thinking of that as the model. In Ethiopia, Roger Mark and Sky here from the Wilson Center both had the opportunity to visit a LEM Ethiopia project that specifically puts a LEM Ethiopia worker or contracts a government worker within a local government office to start integrating the work of the community health extension workers that are paid government health extension workers with the government agriculture and natural resource management extension agents. That speaks to sustainability when it's not an outside model that depends on 2-3 years of funding. If you set up the systems and there's the local commitment, then I think, as I said, things are promising in terms of scale and sustainability. And then my last comment is to Kathleen's comment about, are there policies or are there levers that we could be thinking about to enable the environment? I think that generally the policies in the places where we work are already enabling. The poverty alleviation plans talk a lot about integration. They include health and agriculture, conservation, family planning, but it's in the how to do it where things really fall down or the integration doesn't happen. We're to try to make a connection in Ethiopia between the existing national growth and transformation plan, which is the new policy. We're actually providing support to a local organization to write a brief on how PHE responds to the growth and transformation plan. So put it into the local language, the local priorities, and show it is something that fits within the government priorities. So from my perspective, things are promising, and it's really just a matter of keeping up with all the great things that are going on, meaning, we need to get out there more often and work harder. So.
And any reflections on that analysis, optimistic analysis?
I wanted to endorse the idea that came up, about connecting more maybe social entrepreneurs to ongoing PhD efforts, because I think this, they come with some creative business models
Right.
that could really sustain some of the livelihoods work and really address that issue of, lifting people out of poverty, and also some of the money, gained from, let's say, an ecotourism kind of venture or something like that could feed back into continuing these kinds of integrated programs.
Yeah, certainly PRB and Jason's project to map these different projects is something that's terrifically helpful and can give you a graphical view of exactly the point he's making in terms of the proliferation of those projects. A very helpful one, and one that I think it's fair to say, Jason, when folks look at the map and you see ones that you know about that are not there, tell them about it so that they can integrate that in, so that we can have this sense of the whole, and so that it's larger than the sum of its parts. Kristen and gentleman there, so you can just
I
get the
think
two of them, and got
you're
some over
calling
there
me.
on the other side too. We won't forget you.
I just had a quick note along this line. Just a quick note along the line you were talking along. I'm Christopher Moore with the U.S. Environmental Protection Agency. Our research arm is undergoing a major reorganization, mostly focused on integration and sustainability. One of our new major research areas is going to be the Safe and Healthy Communities Research Program, which is community-based, focusing on integrated research. So right now we're working on what exactly that's going to entail. Around the fall, I think we'll be finished with OMB review, but we're going to be putting researchers and funding into this. So it's worth keeping an eye on us.
Terrific. Well, at the reception that follows, I think a number of us will want to come have
Did I
a
say
chat
that? Did I
with
say
you.
that? Yeah.
Because all joking aside, it clearly is one of the things that a number of us have recognized as potential, but not yet really realized, which is, we've had scholars like Laurie Hunter and David Lopez Carr here who are working in this space from the academic side, who have a fleet of graduate students who are interested in doing this field-based work. And it's finding the funding and the early conversations to connect them with the field-based programs that, as Heather said, often don't have the time or the resources or the know-how to pursue the operations research or the even real kind of strict control comparison work. But if we can have, the kind of, whether it's EPA or National Science Foundation, or the kind of long-term funding that provides that academic perspective, and match it up with the field-based stuff, then we can really get a terrific evidence base. So, Kristen, would you like?
If
Sure.
I could just add to that, Jeff, I think it's also going to be important when you talk about this fleet of graduate students, that we think about those graduate students in these countries. Because I think that's, we talked about youth, we talked about the importance of research and evidence sort of driving this work, and sustainability. So sort of making sure that we continue to focus on cultivating that within countries and within the research institutions among young researchers, I think is a priority action moving forward.
And actually, Population Reference Bureau has some resources for those kinds of endeavors, as well as some of the others here too. So we need to make sure folks know about those opportunities. Kristen?
So I'm Kristen Patterson with the Nature Conservancy's Africa program, and I had two thoughts. One was about the moniker, and I think I like the idea of the HELP moniker. I think that's a good one, but thinking about how to tie in the integrated PhD type work to governments and at the policy level in developing countries, I don't know if HELP is any better than PHE. It probably still is just as a new confusing acronym for them, but one idea, and this is something that we talked about in last week's presentation about Madagascar, was going with a framework that more closely aligns with how government ministries are set up in developing countries. And so I think the Nature, Health, Wealth, and Power framework actually is a lot better fit. And that's sort of the PHE Plus framework that we ended up using in Madagascar most recently, before all aid ceased to Madagascar. But nature, health, wealth, and power. Nature includes environment, natural resources management. Tied to the environment, ministry in a country. Wealth is the livelihoods component, which, in developing countries, if you're talking about PHE or help, if you're not really focusing on livelihoods, people aren't probably going to be as interested in it. And then wealth, getting more finance ministers involved in this and appreciating it, how it can actually grow the wealth of their people. And power, the good governance component is often the reason why a lot of projects fail in developing countries and rural areas. And so that's just an idea of using that framework. Another thought was on the adaptation component. I definitely concur with what several people have said, that best not to focus on the carbon dioxide component when we're living in a culture like the United States or other developed countries, but adaptation is the right way to focus. And one thing that we're doing right now in Western Tanzania is we have funding, actually from USAID, to work with work with governments at the district level in Western Tanzania to help them plan for adaptation. And so in the areas where we will eventually be doing this integrated PHE project with Pathfinder and with Frankfurt Zoological Society, we'll actually, hopefully, know down to very specific levels how climate change will impact these communities, and then what they can do about it at the very local level. So hopefully that will then yield better results in the long term.
Gentleman over there has been very paid. We haven't hit that side of the room, and then I see over here too. So maybe since we're getting closer to the end of the time, we'll collect a few and then give folks an opportunity to respond to Kristen's point and some of these other questions as well.
Thank you. I'm Bill Millen, also with the Nature Conservancy, and I apologize. I'd stuck my hand on before, and I'm not going to pull it down now. So I was very interested by what I think I hear a consensus that more of these projects need to include livelihood elements from the get-go. And I also hear a lot of concern about scalability and sustainability. And I don't know, I've been following this first at the State Department, then at the Nature Conservancy now for the better part of 30 years. And I wonder if it isn't an interesting question to ask to some of the practitioners with their vast experience sitting up on the stage. When you look at history, people who come up with really good economic ideas or social ideas, they tended to be self-replicating, which is to say that you didn't need to have a lot of foreigners coming in from the outside to convince people to repeat these ideas. People, when they heard about them, they repeated them voluntarily. And if necessary, they went looking for the capital to do it. And I'm wondering if maybe as a broad general principle, these projects should not all include some element of improved human welfare that is sufficiently compelling that the local people themselves will react to it by saying, wow, that really works. We should do more of that. And I'd be interested in your reactions.
Good. A great supply versus demand-driven process. Was there another hand on this side? Yep, right there.
I'm interested. My name is Sheila McDonald, Population Strategies Group, and I'm interested in the use of words in all these subject matter areas. And this is for Gib and Kristen. Over here, what you brought up. I was at the Environmental Film Festival. I went to a lot of them, and there was a piece by David Attenborough, and he said, what's happening? People won't use the word population or the subject of population. It's off limits. And my question to you is, why would you want to go to something like Help Plus when the population element is one of the most critical but the most difficult? And I would like to ask you, you alluded to the fact that Help Plus is better because there's problems with P, H, and E.
So if you can.
And I want to understand what those problems are.
Sure. Okay. There's one more over there, but why don't we take these and then give Sky a chance to walk around the room? So we had Kristen and the two from this side. Who would like to divide and conquer and pick up any of those themes?
Well, I'll start with the first question. I think it's a very important point, and I think in the communities that I've seen, often the communities themselves don't have the skills sometimes to take on what it is that we offer them, or they don't have the systems in place. I mean, when you're talking about family planning in remote areas, there just isn't any. And so part of what you're doing in those areas is bringing in, like Sono said, the government systems, facilitating those systems to reach these very remote areas, so that there are commodities and there are trained personnel who can, distribute the methods and who can provide health care. And so some of it is sort of a systems failure. And so the projects are improving the systems, and hopefully those are sustainable. On the environment side, I think, and on some of the more livelihoods piece, some of it also is, again, a capacity transfer of skills. How do you manage your resources? What are the livelihoods how do you improve your agricultural practices? But what I've noticed is that you get the champions that these projects produce, and then those champions, the ripple effect, that's where you really see the take-up, some sort of the social capital that you're talking about. And I saw a really good example of it, in Rwanda. This group of farmers, coffee farmers, who were growing this very expensive, fancy coffee that was being shipped off to the States, their incomes were really improving, and at the same time, I couldn't believe when they told me this. They said, we're so happy because we're cleaner now. And I thought, cleaner? Well, it turns out, their water activities, they have cleaner water, they're washing their clothes. I mean, I hadn't even thought of the health activities sort of improving their own sanitation, but they said, we are cleaner, and the people around us now want to be like us. And they also want to see, we're planning our families, and they want to plan their families like us. They're getting tested for HIV. They're talking about HIV because we're happy to talk about it. And it was so interesting because we were asking them, well, what do you mean you didn't want to talk about it? And they said, before we used to hide, and they had their shawls, and they were hiding under their shawls. They said, we didn't want to talk about HIV, we didn't want to talk about family planning. And now we do. And so I think the diffusion of innovation, in a way, comes from those champions that you are training and that you're working with, who then become the ones who train others and who are the champions for others.
And I'll just add a little piece to that. I think many of these projects also have an element of celebrating success and holding up as examples. And very often, other communities or other individuals in the community look to those people as models and want to be like them and want to emulate. So that sort of builds into this idea too.
Yeah. I'll address the nomenclature, I guess. I love that name, Nature, Health, Wealth, and Power. I think it's great. As far as I'm not suggesting running away from population. I'd be the last person to say to do that. And I think it's really unfortunate that it is a word that has to be said in some circles in hushed voices. And when political climates turn, that people feel they've got to change the way they talk about things. But I also think that in some sense there's also no sense in holding a piñata in front of somebody so that they can hit it down. And if moving the P later into the name, you'll notice it's still in there. And that was a conscious decision because I think it is very important. But I don't see the use in keeping it up front where it's being acknowledged over and over and over again by people as, well, I can't talk about this in my conservation organization because isn't that a USAID population reproductive health funded thing with population as the first name? So that's why it got moved. And then in terms of what the problems with each letter were, I was more just trying to highlight the flexibility of a new name like HELP, which is to show that H for health can mean so many different things. E for environment can mean so many different things. P for even P, it's usually family planning, but it can be other things. So I was just trying to highlight that this name or some other new name showcases the dynamism and flexibility and unique way of meeting community needs that these programs have.
We have Linda, but over here, Sky, you're right there. The gentleman has a question. Yep, and then we'll come over to Linda.
My name is Bob Leach, and I'm a dilettante, but for the last 7 years I worked in East Africa for AMREF, and during that period I worked in them for nearly 4 years in northern Uganda, and I'm fascinated, Heather, by what you said, because I spend a great deal of time not necessarily involved in population, but very much seeing it. And the idea that the problems are on such scale that what we're doing appears to be so tiny. It was Bartlett, the Nobel laureate, who said mankind's greatest weakness is his inability to understand the exponential function. And if anywhere I've ever been in my life, other than Ethiopia, exponentiality and population, it went from 6 to 36 million people in 30 years. And the average age in Uganda is, 15? And if ever I saw its greatest manifestation, it was once the LRA had got quiet in the north, and we began to drive from Gulu down, and I'm sure you've done it, Gulu to Kampala. And the greatest manifestation of all is charcoal. Bags of charcoal that are almost like fence posts. When my wife used to drive, because she frightened me, I used to count them to distract myself. And I actually got to 1,800 on one side. And we hadn't done half of the 300 kilometers. And aside, I wonder if anybody in this room has ever looked at the consumption of charcoal in a country as a marker for, the effect of population on health, on non-population.
Well, Sky goes around to Linda. Anyone want to respond directly on the charcoal and NRM connections?
I can speak to that. I think there definitely, I can't say that, any of the projects that we've talked about today are the ones that we fund at USAID is looking specifically at the sort of what's the relationship between charcoal production and population growth and environmental degradation. But one of the major causes of environmental degradation everywhere in Africa is charcoal. Even in Asia, I mean, Cambodia, for example, charcoal production is completely decimating the forest there. And so it is a threat that is definitely recognized to environment, to conservation. And it's a threat that's driven by population and consumption, and growth of population and consumption. But PHE projects really are more looking at addressing the threat through the conservation strategies, and then addressing the population growth by going into areas where there's high need for it and there's high demand for it, but it's not being met.
Linda?
Hi, I'm Linda Bruce, the director of the Balance Project, and actually I'm a bit too late because I wanted to follow up on the acronym name. I think the whole thing around, I agree that there needs to be a livelihood in there somehow, because in most of the projects that we're supporting, many of the organizations have a livelihood component. So we're missing that. It'd be nice to have that in the name. But I just want to remind everybody that we're having a real intellectual discussion about what to call it. But in the community, nobody gives a flying you know what, because all I know is you're coming in and you're giving them a little bit of, you're giving them methods, you're giving them health, you're helping them with livelihoods, with beekeeping, or with in Zambia with the co-op, and so they're seeing improvement in their lives. They have no idea what they call it. They have no idea who funds it. They just know that it's happening in the community. So I just would like to bring it down to the lowest common denominator here. The community really doesn't care. So we can call it out anything we want to, and it doesn't really matter. But where it matters really is in the community.
Back to Gibbs' original point. I don't care what you call it, but just do it. Okay. Well, I think that's a good place for us to wrap this part of the formal discussion. And as I said, adjourn to informal discussions. I want to thank the four panelists who I think really gave us a tremendous overview and drilled down on a number of points. And so I want to thank you all for the preparation. Congratulations to Gib on the focus piece. Thank you all for some really excellent questions in facilitating the extended conversation. And so please join me in thanking our guests for what's really been an